Hello and welcome to the Pillars of Good Health. My name is Giordano and I am the creator of the Pillars of Good Health, and I wanted to take a moment or two to just kind of explain how we work with people, and it may give you an opportunity to evaluate if we would be a good fit for you or your loved one. The Pillars of Good Health, I started in the field in 1990 as a milieu counselor, and from that I branched off to be working on my own, doing some support work with clients who may have lived in the community or lived in halfway houses. And later on in life, in 2008, I entered graduate school, and it was in graduate school that I was really able to evaluate and define my process that much further. And from that came the Pillars of Good Health. The Pillars of Good Health are medication compliance, sleep hygiene, nutrition and dietary awareness, exercise, social and vocational skills, and spirituality. And I think in theory they apply to all of us. When we are working all of those pieces into our life, we tend to have better health and wellness, and that really defines our work. If I took it a step further, I would say to you, looking at the work, the therapist is going to come up with a conceptual plan in his or her office of goals, ideas for treatment. We take that a step further in that we build an action plan around those goals. So it might be a client who wants to exercise. We're going to go to the gym with them. We're going to help that person shop in a way at the grocery store that maybe helps them with their budget, but also provides a more nutritionally sound diet to go along. So it really is an action plan based on what the goals are in the therapist office. It's really helpful for you to know that every single one of our staff is a master's level clinician. They are able to understand the constructs with which the client sees the world, and then generate a coaching mantra to go along with that to really help get that client to the goal that they want to be working on and they want to have success with. If I'm able to give you the 3 or 4 areas that we work on with people out, at Pillars, there's a few of them. The first one being community-based mental health and case management, where we're going out and we're seeing a client in his or her apartment out in the community and working on their action plan with them. The second one being the supportive apartments that we have. The supportive apartments, we have 12 beds, and it really allows a client who needs a little bit more support than full independence to come into Pillars. They may step down from a place like a halfway house or a hospital stay or a longer term facility to step into independent living with some more checks and balances, and they'll do that for a small period of time before stepping out into their own apartment. The third area is what I call our psychiatric care level, and we will partner with longer term assisted living facilities and provide psychiatric supports for people. But they're also in, they may have their own apartment there, but they still need some psychiatric supports to manage life and move forward in their lives. I think the beauty of the work that we do, we'll work with clients from 18 to 80 and really meet people where they're at out in the community. So I hope that this has been informative for you and give you a little definition of Pillars of Good Health. And if we can be of service to you, please give us a call. Thank you.